Hi, I'm Janika, the manager of Early Childhood Development Services at Jane Pauley Community Health Center. Jane Pauley Community Health Center has partnered with Cradle Indy to bring you more information about safe sleep practices. According to the American Association of Pediatrics, sudden infant death syndrome, also known as SIDS, is the leading cause of death amongst babies between 1 month and 11 months of age. African American and Native American Alaskan Indian babies die at a rate more than twice that of white babies. To reduce the risk of early death, pediatricians suggest that all families follow safe sleep practices. You can easily create a comfortable, safe sleeping environment at home for your baby with a flat surface and a crib or bassinet. Many of us have heard of the ABCs of safe sleep, but what exactly does that mean? A is for alone. The AAP recommends sharing a room with your baby for at least the first 6 months to a year of life. This can decrease SIDS by up to 50%. Placing your baby's crib close to you can help you feel close to each other and make it easier for you to reach them during the night. However, your baby should sleep in their own space, away from people, free from toys, without blankets, cushions, or bumpers. When a baby sleeps with an adult or unsafe items in their space, accidental strangulation or suffocation can happen. Once you get home from the hospital, your baby no longer needs a head covering, as this can cause overheating. If you're worried about your baby being too cold at night, you can dress them in sleep clothing or a wearable blanket, but don't use weighted items. Those aren't safe. B is for back. It's important that you always lay your baby on their back for the first year of life. When babies sleep on their sides, they have a higher chance of rolling onto their stomachs. It's okay if you swaddle your baby, but once they begin rolling on their own, swaddling is no longer safe for them. If your baby rolls over in the middle of the night, gently place them on their backs to keep them safe. Parents are often worried about their baby spitting up and choking, but research shows the gag reflex will help prevent this, so trust your baby's body. Placing your baby on their back to sleep is always the safest way to go. If you're in the car and your baby falls asleep, it's okay to let them sleep while you're in the car, but once you get in the house, immediately place the baby back in their crib or bassinet on their back. When babies fall asleep in their car seats and their heads fall, their airways can become blocked and cause suffocation. As the AAP says, on their back, every nap and every night. C is for crib. Your baby should always sleep in a crib or bassinet on a flat, firm surface. According to the AAP, when your baby sleeps on a couch or soft surface, their chance of dying from SIDS increases by 67 times. If you don't have a crib or bassinet and you're in an emergency situation, please check with your local health or social services department to help you find one. Early death from unsafe sleep practices can happen to anyone, and the effects can be lifelong. Using the ABCs of safe sleep and placing your baby alone on their back in a crib gives them the best chance at leading a full life. For more information on safe sleep practices, please talk with your Jane Pauley pediatrician and visit the AAP.org.